over the last 20 years, there's been a lot of interest in the association between metformin and vitamin B12 deficiency. So a lot of drugs has been associated with vitamin B12 deficiency, and this just speaks to the fact that vitamin B12 absorption is quite an intricate process that requires a lot of proteins, receptors, and an acidic environment in the stomach as well. So we know that people with type 1 diabetes are predisposed to vitamin B12 deficiency. So the rest of the talk due to autoimmune diseases, so I'm just going to keep to the type 2 diabetes and B12 deficiency. A lot of drugs that is used in the management of people with type 2 diabetes, such as proton pump inhibitors, you might know these drugs as Meprozoles, can also cause a vitamin B12 deficiency. And this also impacts on whether people develop a vitamin B12 deficiency if they're on metformin. But it has definitely been shown that metformin definitely increases the risk of vitamin B12 deficiency, and this is dose dependent. So if we think that the liver stores a significant amount of vitamin B12, it will take up to 5 years if vitamin B12 decreases all your vitamin B12 absorption for your stores to be depleted if it was the metformin only. Studies have shown that proton pump inhibitors, the Meprozoles, can decrease this around 4 years. And with these two drugs used together, obviously the risk is much higher. So there's no clear guidance from endocrine societies as to who to check for B12 deficiency. It is suggested that in someone who has had metformin for 5 years, B12 stores need to be evaluated. I tend to look for vitamin B12 deficiency if there is any clinical sign, and remember that anemia is a late sign of vitamin B12 deficiency. So in any patient, even before 5 years, who develop a peripheral neuropathy, for instance, this is the tingling and burning of the feet due to the diabetes affecting the nerves. B12 also affects that. So even in someone who develops a peripheral neuropathy before 5 years, I check the vitamin B12 levels if they have been exposed to metformin, because you don't know with what B12 stores they started out with. So the consequences of B12 deficiency is significant. So I've mentioned the anemia, but that doesn't necessarily have to be there to have the other abnormalities. So we know that B12 plays a specific and a significant role in mood and cognition, and also in the peripheral nerves. And if metformin causes a B12 deficiency and the B12 deficiency is undetected and untreated, certainly there is significant risk. But we must remember that there's significant benefit in the use of metformin. Metformin was the anti-diabetic agent that's been used for the longest time, so we know exactly what to expect from this drug. And it has been shown in numerous studies that the cardiovascular benefit, the microvascular benefit, which is indeed this peripheral neuropathy and so forth that can occur due to hyperglycemia, can be impacted significantly on metformin. It has been shown that the mortality with the use of metformin can decrease up to 30%. So when we use these drugs for those benefits, it's important that we manage it. With that, I mean that we must know these drugs well, and we must know exactly what adverse effects we can expect of them. And if we manage that well, so if you are aware of the B12 deficiency and you address that appropriately in someone using metformin, you will still get the advantages of the reduction in mortality, and then you will not have this adverse effects that a lot of people are worried about.